everyone. Thank you for joining us today. My name is Jennifer, and I will be your WebEx host for today's webinar. Before passing the presentation over to our moderator, Daniel Bornstein, I'd like to provide a few tips for using WebEx so that you can get the most out of your experience. All attendees will be in listen mode only. Should you experience technical difficulties, such as not being able to hear, view the WebEx screen, or PowerPoint, you may contact me at any time using the chat panel and selecting host from the drop-down menu. If you need to view live closed captioning, please refer to the media viewer panel. Please feel free to submit your questions throughout the presentation in the Q&A panel and select all panelists from the drop-down menu. We will ask them on your behalf during the Q&A portion of the webinar. I also additionally want to make note that today's webinar is being recorded and will be posted online at a later date. With that, I will pass the presentation over to our moderator.
Yes, good afternoon, everybody. Thank you so much for taking time out of your day to join us. My name is Dan Bornstein, and I will be moderating today's session. And today's session represents a joint venture between the National Cancer Institute and the Physical Activity section and the Food and Nutrition section of the American Public Health Association. And so my particular thanks to Laura Dwyer from NCI and Laura Esparza from the Physical Activity section of APHA and Joan Trendell from the Food and Nutrition section of APHA for really putting this great webinar together. My role basically today will be to sit back, as you will as well, and listen to Dr. Dwyer's presentation, which I'm very anxious to hear, and I'll be helping field your questions among our discussants, who you'll see listed here, Dr. Linda Nebling, Dr. April O, Dr. Frank Perna, and Dr. Erin Hennessy, who all will be available along with Dr. Dwyer to answer any questions you may have. So thanks again for joining us, and I am now going to turn it over to Dr. Dwyer.
Thank you all for joining us today for this webinar, and a particular thank you to the Physical Activity section and the Food and Nutrition section of APHA for inviting the idea of this webinar topic and for collaborating on it. Also, thank you very much to Dr. Dan Bornstein for moderating today. So today we're pleased to present an introduction to the National Cancer Institute's Family Life Activity, Sun, Health, and Eating Study, which is also known as the FLASHE study. And we hope that the information provided today will be helpful to you in using the data set if you are interested in doing so to analyze your own research questions, and in highlighting some current findings from the FLASHE data that are relevant to health behaviors among parents and adolescents. We do plan to cover several topic areas today. So first, we will provide a brief background of the FLASHE study, including an overview of the study methods and participant characteristics. We will also highlight the survey conceptual model which guided the measures in the survey, as well as provide some example measures from items in the FLASHE surveys. We will then turn to presenting some of the recently published findings using FLASHE data, and we will also highlight some other resources that provide some more detailed information not covered in this presentation, but which may be helpful to you if you plan to analyze the data yourself. And finally, we will have a Q&A session at the conclusion of the presentation with the BRP Behavioral Research Program FLASHE study team. So for those of you who may be hearing about this study for the first time, this slide here just presents some very brief introductory facts about the FLASHE study. FLASHE was a cross-sectional survey study that was administered by WestStat between April and October of 2014, with the purpose of assessing correlates of cancer preventive behaviors among dyads of parents and their adolescent children in the United States. The surveys were administered over the internet, and a total of 4 surveys were administered to each dyad. So each dyad member, parent or adolescent, if he or she completed the study in full, completed both a survey focused on dietary behaviors as well as another survey focused on physical activity-related behaviors. In addition, a subset of the FLASHE dyads were assigned to an accelerometer protocol, which we call the FLASHE motion study, and this involved a week-long accelerometer data collection for the adolescents. And finally, data and associated resources from this study are and will be available for public use. So currently, the diet data sets are available on the study webpage for public use, as are many data user resources, and the physical activity data sets are in the final stages of being prepared for public use. In the following slides, we will focus on presenting some more specific information about the FLASHE study methods for both the survey group and the FLASHE motion study group. So this chart here is a flow chart which provides a summary of the FLASHE study, including aspects of enrollment, the different study conditions, and the various response rates. Participants for the FLASHE study were recruited from the Ipsos Consumer Panel, which is an online panel of adults in the United States. Participants were first screened for eligibility. Eligibility requirements for the adults in the sample required being aged 18 or older, having an adolescent aged 12 to 17 in the home, and living with that adolescent at least 50% of the time. In addition, efforts were made to balance the sample as much as possible to key characteristics of the United States population. And after these efforts, a total of 5,027 parent-adolescent dyads were invited to participate in FLASHE. Of this invited sample, approximately 39% of the dyads fully enrolled into the study. And what we mean by fully enrolled is that the parent provided consent for their self and their adolescent, and also the adolescent provided their assent to participate in the study. Also, as shown in this figure, the FLASHE participants, the dyads in FLASHE, participated in the study as part of one of two study groups. So on the left of this slide, you see the survey-only group, and this group received only the 4 online surveys. And there was also a motion study group. And for motion study dyads, while parents self-reported their physical activity, adolescents both self-reported physical activity and also wore accelerometers. Study completion in FLASHE is defined as a dyad completing all of their study procedures. So that is completing all 4 surveys and the adolescent wore the accelerometer if applicable. So as you can see in this figure, roughly 86% of the survey-only group completed the study and 59% of the motion study group. Combined, this results in a total of 1,479 dyads who completed all of their study procedures, which corresponds to roughly a 29% overall response rate out of those who were initially invited to participate in the study. One thing to note is that sample sizes will vary in FLASHE analyses depending on the individual survey and type of analysis of interest. So if you're interested in an individual survey or analysis or a dyadic analysis. So for example, if you were interested in just the adolescent data, the sample size would be higher than this 1479, which requires full participation of the dyad. And if you're interested in learning more about these aspects of the study, so things like the recruitment and balancing of the FLASHE sample, aspects such as participant characteristics and statistical weighting, there is much more additional information presented in April O and colleagues' paper listed here, and which was recently published in the American Journal of Preventive Medicine. So here's just some more brief information about the survey portion of the FLASHE study, which is applicable to all dyads in FLASHE. Again, the survey aspect involved 2 surveys, one focused on diet and one focused on physical activity. And before participating, dyads were randomly assigned to receive either the diet survey or the physical activity survey first. All surveys were administered online, and each dyad member needed to complete their first survey before the second survey was received by either of the 2 dyad members. We will, in a few minutes, present some example measures that were included in these surveys, but broadly within each of the 2 surveys, The relevant behaviors, so for example, dietary behaviors or physical activity behaviors, were assessed via self-report, as well as potential correlates of those behaviors based on existing literature, as well as expert feedback. And of note, although the physical activity depicted in the physical activity survey depicted in the middle of the slide focused on physical activity, it also included questions on other health behaviors, including sun safety, tanning, sleep, and tobacco use. And at the end of the first survey that participants received, there was an additional module which was sent to both parents and adolescents, which assessed parenting style and sociodemographic variables. Dyads who participated additionally in the FLASHE motion study received several further instructions. The motion study protocol involved the adolescents wearing a wrist-worn actigraph accelerometer continually for a period of 7 days. During this same time, they also completed a daily activity log where the adolescent recorded information such as the dates they wore the accelerometer, when they went to bed and got out of bed, and whether they were in school during their accelerometer wear week. The accelerometer data collection for adolescents was also closely timed with the physical activity survey. The physical activity survey for adolescents contained a measure, the youth activity profile, which was developed by Dr. Greg Welk and colleagues at Iowa State University. And this measure assesses physical activity in the past 7 days. So because of the reference time period in that measure, the physical activity survey was made available to motion study dyads after the adolescents completed the accelerometer wear week. And the purpose of doing so was so that ideally the time period referenced in responses to the youth activity profile would match the time period that the accelerometer was worn. And last on this slide, there were a total of 509 adolescents who wore the accelerometer for at least an 18-hour wear period. This slide just presents some demographic characteristics of the FLASHE sample. The sample size on this slide is the number of dyads who completed all 4 surveys, regardless of whether or not they also completed the motion study protocol. So of these participants, as you can see here, the adolescent sample was gender balanced, and the parent sample was predominantly female, so about 75% female parents. 70% of parents and 64% of adolescents in the sample are non-Hispanic white, 16% of the sample is non-Hispanic black, and 7% of parents and 10% of adolescents are Hispanic. Just under half of the parents had a 4-year college degree or higher. 72% of parents were homeowners, and 65% currently employed. And finally, in terms of some family characteristics, 72% of parents are married, and 60% of the households in the sample have at least one additional child in the household besides the adolescent participating in the FLASHE study. So in the next portion of the presentation, we will focus on the FLASHE conceptual model, presenting that. And again, that underlies the survey measures in the FLASHE's diet and physical activity surveys. So the FLASHE conceptual model and development of the study is described in detail by Linda Nebling and colleagues in a recent paper cited on this slide. The FLASHE conceptual model is shown here. And this model was informed by a multi-step process that involved literature reviews as well as extensive input from scientific experts. This model is informed by social ecological models of behavior and includes several areas that are from conceptually multiple levels of influence and also relevant to health behaviors, including the neighborhood environment, home environment, parenting factors, as well as individual level factors. And in this model, these areas are hypothesized to relate to the primary FLASHE outcomes of adolescent and parent dietary behaviors and physical activity behaviors. as well as other behaviors including sun safety, sleep, and tobacco use. At the bottom of this model, you will see that highlighted is the association between parent-caregiver factors and adolescent factors. And this is a unique area of the FLASHE study because it is dyadic in nature, and therefore it does allow for an examination of the parent-adolescent relationship. So survey items within each of these areas of the conceptual model were developed in consultation with scientific experts in several areas relevant to the FLASHE study. Items were then cognitively tested before the survey was implemented, and items were modified or refined as needed. And consistent with the purpose of FLASHE's dyadic design, the same questions were asked of parents and adolescents where possible. So on the next few slides, we'll provide some more specific information about how the health behaviors in FLASHE were assessed, and we'll start with the dietary behaviors. So in the FLASHE diet surveys, dietary behaviors were assessed of both parents and adolescents using a 27-item dietary screener modified from the dietary screener questionnaire. And this measure on food and beverages captures the usual consumption of various foods and beverages with a recall of the past 7 days. An example item assessing fruit consumption is shown here on this slide. And these measures were dyadic, so that is assessed in both the parent and adolescent surveys. Using responses from these items, Dr. Amy Yarrow and colleagues at the Gretchen Swanson Center for Nutrition have computed some derived variables which will soon be publicly available to facilitate analyses of dietary behaviors in FLASHE. So these variables include daily frequency of intake of several types of foods, as well as estimated daily intake. So for example, cup equivalents of fruits and vegetables per day. And if you're interested in this, in learning more information on the estimated daily dietary factor intake in FLASHE, please reference this paper by Teresa Smith and colleagues, which focuses in that area and which can be found in the American Journal of Preventive Medicine. Physical activity was the other main outcome variable in the FLASHE study, and this was assessed with different measures among both parents and adolescents, though both measures estimate minutes of moderate to vigorous physical activity. So the adolescent physical activity measure was the youth activity profile. An example item assessing activity on the way to school is included here on this slide. So in this measure, adolescents answered questions about their physical activity behaviors before school, during school, after school, and on the weekend, as well as items on their sedentary behaviors. And informed by data from the motion study portion of FLASHE, Dr. Greg Welk and colleagues at the Iowa State University computed estimates of moderate to vigorous physical activity in school, out of school, and on the weekend for adolescents who participated in the physical activity survey. And much more information on the algorithms and approach for computing these variables is available in a paper by Dr. Pedro St. Maurice and colleagues, which is cited here. And these computed variables will be included in the forthcoming adolescent physical activity data set. And the parent physical activity survey includes items from the short form of the International Physical Activity Questionnaire. An example item here is assessing moderate intensity physical activity. And data users can use these variables in the survey to also estimate weekly minutes of physical activity for parents. While this presentation will not present the exact measures used for assessing the other behavioral variables in FLASHE, this table here does provide a summary of the types of measures that were included. These behaviors here were assessed of both parents and adolescents, and often with the same or similar measures where possible. So sedentary behavior was assessed with the youth activity profile among adolescents, and the parent and adolescent surveys also include additional items on the types of electronic devices that are used by parents and adolescents. For sun safety and tanning, the type and quality of various sun protection behaviors was assessed, as well as sun exposure and usage of indoor tanning beds. Tobacco use items included the frequency of cigarette usage, quantity of cigarettes, and use of cigarettes to help lose or gain weight during the past month. And finally, the sleep measures for parents and adolescents included usual sleep and wake times on both weekdays and weekends, as well as an item on sleep quality. So the other measures in the FLASHE surveys can largely be mapped onto the different areas of the FLASHE conceptual model. And I should note that all of the full wording of the items as well as the item sources can be found on the FLASHE study webpage in the full annotated surveys, as well as the constructs tables, the item source reference list. Example measures that are assessed in FLASHE that fall under the adolescent factors, which can be thought of as individual level factors, included measures such as those on autonomous and controlled motivation, barriers and friend norms for diet and physical activity behaviors, perceptions of advertising for various foods, and attitudes toward being physically active. Example parent-caregiver factors that were assessed include parenting style, which was assessed as part of the demographic module attached to the first survey, as well as parenting practices specific to the main outcomes of interest in FLASHE. So parenting practices around fruit and vegetable consumption, junk food consumption, physical activity, and limiting screen time were assessed. And parenting was assessed from both the parent and the adolescent perspective. Some examples of the home environment that were assessed in FLASHE include availability of healthy and less healthful foods in the home, availability of physical activity equipment in the home, and the context of family meals in the home. And last, some examples of the community or neighborhood environment assessed in FLASHE included the availability of food stores in the neighborhood, accessibility of physical activity resources, neighborhood social capital, and perceived neighborhood crime. So for the next part of the presentation today, we would like to share some ways that FLASHE data can be used and provide some examples from recent published findings using this data set to highlight different data use opportunities. So researchers interested in analyzing FLASHE data can certainly use FLASHE to examine one individual data set or engage in an analysis on one portion of the sample, so just an analysis with parents or just with adolescents. And example research questions in this area could potentially focus on studying relationships outlined in the study conceptual model or studying other pertinent research questions of interest to you. The survey data sets that are available on the FLASHE webpage facilitate individual level analyses, as each survey's data set is uploaded individually in both SAS and SPSS to allow for individual data downloads. Two recent papers that have recently been published have featured individual level analyses with the adolescent data in FLASHE. So for example, using data from the adolescent diet survey, Meredith Serby and colleagues examined racial differences in sugar-sweetened beverage consumption and susceptibility to advertisements about foods. And a main finding of her analysis was that non-Hispanic Black adolescents were more likely to consume sugar-sweetened beverages per day and were also more susceptible to advertisements about foods compared to non-Hispanic white adolescents in the FLASHE sample. A second individual level analysis was led by Heather D'Angelo, and she found that there were interactions between individual level factors and neighborhood factors when predicting adolescent physical activity. So that is, she found that the associations between individual level factors such as friend norms, attitudes, and motivation with adolescents' moderate to vigorous physical activity were stronger when adolescents also reported living in neighborhoods that had features which supported physical activity. In addition to individual level analyses, the FLASHE individual data sets can also be merged by a dyad identifier for analyses of parent-adolescent dyads. One analysis featured in Linda Nebling's FLASHE paper provides an example of how dyadic data can be useful by featuring example correlations between parents and their adolescent children on a small subset of survey items from the FLASHE study. So in this analysis, example survey items were drawn from each level of the FLASHE conceptual model, and correlations between parents and adolescents from the same dyad were examined. This analysis found that for the reports on the same item assessed in the same way, parent and adolescent reports were positively correlated across items, ranging in value of correlations from 0.32 to 0.63, demonstrating the importance of the parent-adolescent relationship on these select survey items, which are listed here. There are other additional ways that data such as the data in FLASHE can be analyzed from a dyadic perspective. So there are many resources on dyadic analyses. One resource that we do have available that's specific to FLASHE is an introductory webinar on dyadic analysis, which was presented last year by Drs. Niall Bolger and Jean-Philippe Laurenceau, with an example applied to the FLASHE data set. And the example featured in that webinar is an actor-partner interdependence model, which is one approach to modeling dyadic data. Briefly, that model is shown here, and in essence what it does is it allows for an examination of how parent and adolescent reports on a predictor of interest simultaneously predict both one's own outcome and the outcome of their partner in the dyad. So how an adolescent factor predicts both their outcome as well as their parent's outcome and vice versa. And a couple of published analyses using FLASHE diet data to date have taken this approach to modeling dyadic data to analyze dyads in FLASHE. So, for example, in a recent paper, we found that one's own reports of autonomous motivation predicted one's own fruit and vegetable consumption as well as that of their partner. And these effects combined explained approximately 23% of the correlation between parents and adolescents in the frequency of fruit and vegetable intake. In a second study, Dr. Rebecca Ferrer examined associations between emotion suppression and eating behavior in dyads using an actor-partner interdependence model. And she found that greater emotion suppression was associated with eating behaviors of both oneself and one's partner. And the specific eating behaviors that were assessed and included in her analysis were emotional eating, lower fruit and vegetable consumption, and greater consumption of hedonically pleasing foods. And to conclude this presentation today, we would just like to do a brief review of the various resources that are available for FLASHE data users. There are several web resources for data users available on the FLASHE webpage linked to on this slide. These resources are listed here. First, the survey data sets. Again, these are individual data sets of the diet survey, the physical activity survey, and the demographic questions separately for parents and adolescents. These data sets can all be merged for your analyses by individual participant identifiers or dyad identifiers. There are also annotated surveys and a codebook available. These are useful in that they provide documentation of the full survey item wording for each item in the surveys, as well as response options, and they also provide the variable names and labels included in the SAS and SPSS data sets. There are construct tables, and I think I mentioned these earlier, but they provide the number of items assessing each construct and they also provide sources or references from which the construct or measure was modified or drawn directly. There is a methodology report available for data users. This is a document that was written by Westat, and it summarizes the study recruitment and methodology. And there is also a data users guide, which includes information from both Westat and NCI, as well as other colleagues. Much of this document provides information on the computation of various derived or computed variables that have been added to the FLASHE data set, as well as a section on statistical weights, which were developed by colleagues at Westat and Ben May Liu at NCI. And finally, on this page, there's a list of frequently asked questions about the FLASHE study. There is also a specific page dedicated to resources on dyadic analyses. So as I mentioned on a prior slide, there's an introductory webinar to dyadic analysis. This is on the NCI's Behavioral Research Program's webpage, and it's linked to on the FLASHE dyadic analysis page. This provides an introduction to dyadic data analysis with specific application to the FLASHE study. And there is also a document called Dyadic Analysis User's Guide and Sample Code. What this does is it provides sample code in SAS and M+ for running through some basic dyadic analyses, and it also includes annotations for explanation to interpret the statistical output. And finally, the last resource I would like to mention for data users is a theme issue that was published as part of the American Journal of Preventive Medicine's June 2017 issue. This theme issue is a collection of 7 papers and 2 commentaries focused on the FLASHE study, including several of the papers that have been cited throughout this presentation. Guest editors on this theme issue include Leslie Lytle and Louise Moss. And the papers from this theme issue are useful for data users if you're interested in getting more information on the methodology and measurement in the FLASHE surveys. So the papers in this theme issue describe aspects such as study development and conceptual model, participant characteristics and dyad characteristics, more information on recruitment, enrollment, and response rates, methods for estimating the diet and physical activity behaviors from survey and accelerometer data, and they also provide an example dyadic analysis and an example individual level analysis using FLASHE survey data.
You'll be able to find the recording of today's webinar, and the Q&A will be posted online at a later date. You can find the URL on the screen in front of you. I'm also going to send it through the chat if you'd like to copy and paste it into your browser. You can also sign up for the BRP listserv if you'd like to gain more information and just be kind of in the know of upcoming information. If you'd like to continue the conversation, please see the email address on the screen, nciflashe@nih.gov. Again, thank you so much for your participation today.